for this coming presentation is entitled Healthcare Professional View on Accepting COVID-19 Vaccination for their children, a cross-sectional study, presented by Mr. Gladson Vaghela.
You can see my screen. Warm greetings to all from India. My name is Gladson Vaghela. I'm a medical student from Gujarat state of India. Today I will be presenting my research study exploring healthcare professionals' view. My name is Gladson Vaghela, a final year medical student from Gujarat state of India. Today I will be presenting my research study exploring healthcare professionals' view on accepting COVID-19 vaccination for their own children. And the vaccines against COVID-19, the fastest vaccine ever produced for a disease, hence is a matter of concern among the population. Studies from several countries reported that a low number of parents are willing to vaccinate children against COVID-19. In India, yes. You cannot hear me? If you want, I can share with another device if that's okay. Yeah, I'm so sorry. I'll just reshare. I'm so sorry. I'll join again. I'm so sorry for that. Okay. Okay. All right. Studies in India, a study reported that only 33.5% of Indian parents were willing to vaccinate their children against COVID-19. Therefore, to overcome parental COVID-19 vaccine hesitancy for children, healthcare professionals can play a crucial role in influencing parents, particularly those who believe that vaccinations are unsafe. But if healthcare professionals themselves have a poor intention and confidence vaccinating their children against COVID-19, they may also face difficulties cultivating trust in COVID-19 vaccines amongst the general population, particularly parents whom they attend in clinical setting or the community. Hence, this study evaluated the healthcare professionals' knowledge, perception, and acceptability of COVID-19 vaccination for young children. Coming to methodology, cross-sectional analysis was performed at a tertiary care hospital in Western India from May to June of 2022. We received the institutional ethics committee approval before we start the study. Sample size of 422 participants was determined by using a single population proportion formula. Healthcare professionals having children below 15 years of age were included in the study. For data collection tool, a multi-item online questionnaire was developed based on literature review. It included validated and published COVID-19 vaccine hesitancy questions, which were adopted and adapted to the context of the study, increase the quality and validity of the data, and their easy compatibility with other populations. Coming to results, our study included 441 healthcare professionals using a structured questionnaire disseminated via Google Form through communication mediums like WhatsApp or email. Out of 441 healthcare professionals, 51% were males and 48.5% were female. With a mean age of 35.09 years, 76.8% of healthcare professionals were above the age of 30. The COVID-19 vaccination score was found to be satisfactory, with 90% of healthcare professionals being aware of the availability of the COVID-19 vaccines for children aged below 14 years, whereas 62% of healthcare professionals agreed that vaccination against COVID-19 is necessary for children. When asked questions regarding the number of vaccines doses approved for children, 75.8% of healthcare professionals answered 2 doses. Overall, 81.2% of participants were categorized as having a good level of knowledge about COVID-19 vaccination. In perception criteria, 41% of healthcare professionals were neutral when asked whether they were confident about COVID-19 vaccination safety for children. We found that doctors and healthcare professionals over 30 years of age were more likely to vaccinate their children. whereas 73% of healthcare professionals reported a favorable attitude regarding immunizing their children if a new COVID-19 vaccine became available. When asked which vaccine will they prefer for their child, 75% of healthcare professionals chose to give Covaxin or Covishield, followed by Corbevax. Overall, 54.5% of participants were categorized as having a positive perception towards COVID-19 vaccination for children. In acceptability criteria, the most common source of information was academic or peer-reviewed journal, followed by government sources. More than half of healthcare professionals were willing to pay for vaccinating the children if government do not provide free of charge vaccination. In addition, 26% of healthcare professionals have already vaccinated their child, whereas 39% of healthcare professionals will vaccinate their child after a few months of vaccine approval. COVID-19 vaccination acceptance rate among healthcare professionals for their children was found to be 92.7%. In conclusion, as per our knowledge and literature review, this study is first of its kind done in Western India. We found that parental vaccine hesitancy was significantly lower in our population of healthcare professionals compared to other research studies. Majority of healthcare professionals replied positively and were in favor of vaccinating the children against COVID-19. The high acceptance of COVID-19 vaccines among healthcare professionals can serve as an effective channel for promoting parental acceptance of COVID-19 vaccines in the community. We found that healthcare professionals regarded peer-reviewed journals as their most reliable source for vaccine information, followed by government sources. Therefore, the government and other relevant authorities should offer timely and accurate information as it will enhance public confidence and parental acceptance of COVID-19 vaccines. Lastly, I would like to thank the Indian Council of Medical Research short-term studentship program for funding my study. Thank you so much for listening.
Surely, this presentation is inspired us all.
Any questions from our judges?
Sir, congratulations. Do you have any information on the difference between the doctor comparing with other group that is not the doctor in terms of their vaccine's acceptability?
I'm sorry, you need to say the professional doctors.
Because your subjects, your study population is healthcare, right? Healthcare personnel. In that healthcare personnel, you have doctor. I think is for a number of doctor. Are there any difference between the doctor with other groups of subjects?
Right. Thank you so much for the question. We found that doctors at highest level of knowledge and acceptability, followed by pharmacists and nurses, and then lab technicians and physiotherapists. So this was the order of knowledge that was found. We realized that doctors were more willing and had more knowledge than nurses, than a pharmacist and lab technicians. This is also because doctors are more have more access to academic peer-reviewed journals and reading literature.
Thanks.
Thank you.
Any more questions?
Yes, I saw your result. Only 30% of the doctors vaccinate their students. You consider this is high, I think it's very low.
Yes, I think although 30% were willing to vaccinate, but many were willing to wait for a few months, and after that they were willing to vaccinate. It shows that they were willing to vaccinate, but they want to wait for a few months to see the effect of vaccination in children in the population. And after that, they want to go ahead. Definitely, even it was a low number, but they were more willing towards to vaccinate their child when the opportunity arise.
Okay, thank you.
Thank you so much.